Hi everybody, welcome to Healthline. I am Gregory Zarian. Happy New Year. This year has come and gone, and we hope you had a happy holiday. Okay, how quick was this year? Did everything happen that you wanted? Did you stay on course? Did you kind of let things slip? And what is your New Year's intention? It's been a great year for us here at Adventist Health and also here on Healthline. We have a new look, there's a new name, but the same intention. Whole person care and God's love. So we hope you take all that we shared with you this year going into the new year. Now, it's New Year's and New Year's Eve, and things happen and people get in trouble, people get hurt, and people go out and indulge in things more than they usually do. And where do you end up? You end up in the emergency room. So we're going to share with you all you need to know about the emergency room, the difference between emergency room and urgent care, and how to stay out of it. Joining us from Adventist Health is Dr. Lee Jang, emergency room specialist. How are you, doctor?
Great, nice to be here.
Glad, and it's great to see you.
Thank you.
Since we have personal history outside of the show. First of all, before we talk about emergency room, share with us a little bit about your medical history.
Okay, I graduated from USC. I did medical school there. I did my residency in emergency medicine, and that was at Harbor, UCLA. So I'm comfortable on both sides of the football field come Rose Bowl, so I'm flexible.
Yay, team. Why emergency medicine?
It's a fascinating field. You get right in there. It's never the same twice. It's never boring. It's almost never a repetition. Even though you do something, you see it a little bit different. It's fast. It really is quite meaningful. You get to the heart of the matter, and you can reverse and change a patient's course in an instant, in a brief encounter. It's wonderfully exhilarating.
No, I love that. You know, doctor, before we head off into our first break, let me ask you a question. What's the one thing we need to know about the emergency room?
It's busy, it's chaotic, but if you need to be there, and we are there for you. It's not what you think it is. It's not your doctor's office. It's not a low level of care. It is fast paced, it is chaotic, but everything comes together and you will get the best that we have for you.
Wow, I love that. Okay, when we come back, all you need to know about the emergency room and the difference between urgent care and the emergency room. I take a deep breath in and a deep breath out. And we'll see you on the other side. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Happy New Year! As you noticed, same intention, new look, new name. And did you know that once again, U.S. News and Whole World Report names Adventist Health Glendale among best hospitals, ranking number 16 in the Los Angeles metro area and number 28 in all of California, and high performing in 5 categories of care. So for everyone at Adventist Health Glendale, this is to you. Joining us from the emergency room is Dr. Lee Jang. And before the break, I threw out there what the difference between the emergency room and urgent care is. Doctor, what is the difference?
It's a lower level of care at urgent care, and it's a higher level of care in an emergency department. So you might go with minor things that are not life-threatening, to an urgent care, things that can potentially be delayed a little bit, and things that need to be treated right away that could have life-threatening consequences. Those go to the emergency room. Okay,
so let's break it down in regards to urgent care. Give me some of the things that happen, and it's New Year's Eve. So if you cut your hand, is that more urgent care? Share with us what some of those are.
Urgent care can take care of minor traumas. So minor traumas might be a laceration. Could even be a broken bone that needs to be splinted, have x-rays. They can do that at most urgent care departments. But in terms of having surgery, dealing with that broken bone in an operating room, that's not going to happen from an urgent care.
Okay, but an urgent care facility will then, of course, send you to an emergency room or a hospital.
You don't need to go to an emergency room right away necessarily with a broken arm. You can have it splinted, you can have it immobilized, and you can follow up with an orthopedic surgeon in a day or two.
What are other things that happen where people should go to an urgent care facility instead of emergency room?
colds and flus,
Okay.
minor abdominal pains, just minor types of things that perhaps you can't get a hold of your primary care doctor for, things that have been going on for a little while that do not seem to be associated with severe things, severe fever, severe pain, loss of consciousness. Those are things for the emergency department.
So when we're thinking of the difference, emergency room is life-threatening. Urgent care is, it's not as serious.
It's just not as serious. Now that means different things to different people. So the emergency department is never going to say, no, you made a wrong decision.
I'm sorry.
Go back
I'm sorry.
to the urgent care.
You're being
Sorry.
a little dramatic. Yeah.
Yes, we take all people who come to the door as well in urgent care. And if an urgent care is not comfortable treating someone, they will upgrade them into the emergency department and have them transferred by ambulance, or perhaps they can even go by private car. Same with an emergency department. We will treat you, we will discharge you, and have you follow up with someone else later on.
And and people should know, though, that there is a relationship between urgent care and emergency rooms and urgent care and emergency rooms and hospitals. So it's not just going from one foreign establishment to another. There's a conversation, and what's great about Adventist Health, especially here in Glendale,
Yes.
is there is an urgent care, and
Yes.
there is the emergency room, and there is
Yes.
the hospital.
Yes, Adventist Health is very progressive in thinking of a continuum of care. So we have outpatient and minor things that will lead into major things that will lead into hospitalization, post-care. Adventist Health has thought it all the way through.
When someone comes into the emergency room, first and foremost, what do we need to bring from home to assist you, our doctor?
Your medical information and your medications.
Okay, so medical information, break that down. What does that mean, doctor?
Prior medical history,
Okay.
diabetes, hypertension,
Okay.
prior surgeries, when you last saw your doctor. Medications are so important. Allergies, we would like to know those things.
Because truth is, if somebody comes in and they're unconscious, you don't know what they have in their system.
It's very true.
Also the insurance information, they need to have insurance, driver's license. So what we invite you to do here at Healthline is just type something out. Type out what your medication is, what your insurance policy is. Give it to a family and your friend, and also your past medical history, just so it's right there.
You could put it on a refrigerator magnet and just grab it off of the refrigerator whenever you need to go.
Or put it in your wallet,
Yes,
put it in,
yes.
ladies, put it in your purse. Here's a question that I'm sure you get all the time. The wait in an emergency room.
Yes.
People go crazy, and
Yes.
you know, there was a family member that was just in the emergency room this year, and we see so many people waiting and waiting and waiting. How do you decide who goes first? Is it, pick a number and boom, 1 through 10, or does it depend on what is happening to the person?
It's the latter. So the word is triage. We triage our patients according to severity. So even though you may be the first person in the line, you may not be seen immediately if someone farther back has a life-threatening or critical process going on. We will take those first ahead of you. Sorry.
No. So, so what do you then say to us that are waiting in the waiting room from 1 hour to a couple hours? How do you invite us to stay calm?
We value you. We value that you have thought that you are presenting with an emergency, and we want to care for you. Within the first few minutes, you will be triaged by one of our medical personnel. You will be seen. Vital signs will be taken. As much of a brief history will be taken. As soon as you are brought back into the emergency room, you will be seen within a healthcare provider within 30 minutes. So we try and do our best to see you as expeditiously as possible. Sometimes it just takes a little longer with everything else that's going on.
So when we're waiting there and it's turned into a long amount of time, we need to realize that we are important, that you will get to us.
Oh,
and
yes.
that someone that has been in this waiting room, their illness or their situation is more life-altering than ours at the moment.
At the moment, yes.
Okay.
Yes. And should you, quote, quote, deteriorate, if something should happen, you are always being observed by medical personnel there. So if you don't feel well, if something's going on, please tell the receptionist, tell the triage nurse who's right there in front of you, and we'll reevaluate you. We have no problem doing that.
And one thing I want to say too is, because you are saving lives, and I want to say to you too, there is a level of anxiety and,
Oh, yes.
and panic and fear and, oh my gosh, my mom this or my dad that or my girlfriend, boyfriend this. And sometimes we are greeted with an employee that is very business. It's not that they don't care. They are just taking care of what they have to do to make sure that we then get taken care of.
Yes.
More about the emergency room when we come back. Don't go away. Welcome back to Healthline. Did you know that Adventist Health Glendale just received its 6th consecutive A hospital safety score from patient safety organization, the Leapfrog Group? Joining us from the emergency room at Adventist Health Glendale is Dr. Lee Jang. Doctor, what are other signs and symptoms that people come in for?
Abdominal pain.
Okay, and what could some of that be?
Abdominal pain can be something surgical, like an appendix, a gallbladder. It can often be infectious that requires IV antibiotics. It can be large vessels in your aorta, in your intra-abdominal cavity. It's kind of diffuse, and it can just be garden variety. I ate too much, I had the stomach flu, I have a bad case of food toxicity.
With it being New Year's and
Yes,
the holidays,
totally.
what are the most current conditions that show up in the emergency room?
We're going to get a lot of respiratory stuff. So
Okay.
we're going to get a lot of upper respiratory flu type symptoms. Some will be flu, some will be garden variety viruses, some will be pneumonia and bronchitis.
In regards to flu and flu-like symptoms, what is your recommendation to us to stay out of the emergency room and stay healthy?
Get your flu vaccine.
Okay.
Get your flu vaccine. It takes 2 weeks to work, so kind of plan it. Don't think that you're going to go on this vacation and just get it the day before. It's not going to work. It's going to take 2 weeks to get in there.
So flu vaccine and then
Yes.
also just be preventative.
Hand washing.
Hand washing.
Stay away from crowds as much as possible. Don't let people cough on you. Don't share drinks.
Yeah, hi, I love you, don't breathe on me.
Don't.
Yeah, okay, but and just wash your hands a little bit more.
Yes.
A lot
Yes,
more.
a lot more.
What are some other signs and symptoms that we find more so now at this time of year?
So aside from respiratory things,
Yes.
there will be gastroenterology things, because people will be eating quite a bit, consuming a lot. Food may not be prepared well. You may take a cruise, a vacation. Food is not kept at correct temperature, so we'll get vomiting and diarrhea. That's a big one.
If somebody is at home and they're experiencing vomiting and diarrhea, what do you invite them to do before they get to the emergency room?
Stop eating.
Okay.
Stop eating. It's nice if you could see if you can take clear liquids, so just a little bit, small sips of water, small sips of maybe 7-Up with the bubbles knocked out. If you can do that, if you can keep yourself hydrated in an electrolyte solution, maybe you can go ahead and write it out at home. If you have high fevers, you're constantly vomiting, can't keep anything down, you need to come see us and get the IV.
And could a lot of it just be that they're dehydrated as well?
They will get dehydrated,
Okay.
definitely. So if you have significant bouts of both vomiting and or diarrhea, you need to be hydrated with an IV.
In regards to wounds and cuts and abrasions, what do you recommend for us to do before we end up in the emergency room?
If you don't think you could put a Band-Aid on it and it'll work, you probably need to be seen by someone. If you can't stop the bleeding, you do need to see someone. So put pressure on anything that's bleeding, and hopefully with direct pressure, you'll be able to stop the bleeding. That's the first part.
Okay.
If it looks too deep to heal with just a simple Band-Aid coverage, come see us.
And is it, I don't know, and keep your arm up. Like if you cut your arm, keep your arm so the blood doesn't
That
flow.
decreases the pressure,
Okay.
definitely.
See, I know
Good
something.
job.
Thank
Good
you. You mentioned high fever.
Yes.
What is considered a high fever?
That's variable. So generally things over 101 are a fever. High fevers over 103. Fevers that last for a long time, even if it's only 101, 102, you should probably have that checked out, see if it's something that we can treat you for. There's not an absolute cutoff on anything. It's kind of given who you are.
Kids and this time of year and
Yes.
the holidays.
Oh,
Please share with us what we need to know.
Difficult. So infants, small infants under like 6 months of age, anything over 100.8, we get a little concerned about.
Okay.
We just want to make sure that they're doing okay. People who can't take Tylenol, keep that kind of stuff down. Tylenol or Motrin to keep the fever down. We need to see you, because there's no way you can go ahead and treat yourself, especially if you're going to get dehydrated. And if the kids are just acting strange, if they're lethargic, if they're not acting their normal self, we need to see them.
Okay. And what about elderly?
It kind of runs the same gamut,
Okay.
so it's the opposite end, but it's the same thing. So
Okay.
if the elderly are not acting correctly, and they only have a low-grade fever, 100.8, but if they're not acting correct, they need to be coming in. And they can have lots more types of infections, and they'll just have subtle presentations. They're not thinking as well, they're not kind of wanting to eat, they're just a little bit run down. Those are big signs for the elderly.
Backing up real quickly to kids, what should we know about keeping our kids safe during the holidays in regards to, Christmas trees, and there's New Year's and all this stuff? What should we know?
I think it's pretty common sense. Electrical plugs by the tree, things fall down, come on top of them. Radiators, the old-fashioned type that you touch that are going to be hot. We see some of those injuries. Carbon monoxide into areas. There's lots of things that will entrap little ones, and we just need to have common sense. But it's hard because we're really
Sure.
busy, so we don't keep track of our children well. So we sort of have to take a step back and just be good parents.
And one thing too that we adults need to do is just talk to the kids and just say, hey, please, don't touch this electrical cord. If something drops, come to the uncles or the parents or the friends and just say, I need your help. Don't do it on your own. And if there's a question, just ask. More with Dr. Jang and all you need to know about the emergency room when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Joining us is Dr. Lee Jang from Adventist Health Glendale Emergency Department. Dr. Jang, in regards to the emergency room, I have a couple questions that some people, I reached out to social media and these are some of the questions that they came up with. When should someone call 911 versus drive themselves to the emergency room?
When they don't think they can make it to the
Okay.
emergency department, when they're having something very serious going on, serious chest pain, loss of consciousness, I banged my head. Sensible things.
Sensible things. And don't be a Superman or a Superwoman.
No, that's what 911 is for.
Okay. When is the busiest time in the emergency room?
Usually when people can get to the emergency
Okay.
department. So if it's during a business day, it might be a little bit more quiet. During the daylight hours, it gets a little bit busier, like 5 to 6 when people get off work. Kind of gets busy Sunday night. Monday is typically our busiest day, and sometimes Thursday night too. Not sure why, but there you go.
But even if when you get there and it's busy, just know that you will be looked at, as I said earlier, and taken care of, and that their mission is to
yes.
make sure that you're okay.
Oh yes, we want to see you.
We all watch TV shows. We all watch Grey's Anatomy and Chicago Med and all these shows that talk about catastrophic situations that happen in emergency rooms. Talk to us about Glendale and how prepared we are.
Okay. There's individual catastrophic things and sort of group catastrophic things, if we could break it down. Individual things might be a major heart attack,
Okay.
a stroke occurring, and Glendale Adventist is an A+ neurologic stroke center, which allows us to not only give the clot-busting medication for strokes, but we actually have 24/7 neurointerventionalists who can
fantastic.
go ahead and just take care of clots that are causing you to have the stroke, and you could immediately have a result and in 6 hours be back to normal. It's really quite amazing from your stroke. We're also a heart STEMI center, so we can take care of your acute heart attack, zip you up into the cath lab. We actually have awards for who gets who up the fastest.
Oh.
That's our goal, is to have no delay to get you up as fast as possible so you can have the interventions that you need in both stroke and heart attack. So individually, we are prepared for catastrophic things. Now, the group things, like recently we had tragedies that have been happening across the nation, Las Vegas being one of them. Those are things that all hospitals are beginning to drill for, get ready
Love that.
for. Active shooter scenarios, catastrophic things with mass casualties. We've had train accidents, we've had earthquakes. I've
There's
worked earthquakes.
fires.
There's fires ongoing right now where people are being evacuated. So we are also prepared, and we work in the community with Glendale Fire, Glendale Police, and our other sister hospitals, where no man is an island in the group things that happen.
And so, I love that, because going back to what I said earlier too, is just there's constant conversation.
Yes, there has to be. And it's constantly changing. As people devise more ways to injure one another and hurt one another, we have to stand ready to receive them.
What do you feel is mandatory for all of us to have in our homes in regards to an emergency first aid kit?
Good thing. I think simple things like antibiotic ointments, things that'll stop bleeding. Okay. I don't think you need to necessarily have major, Vietnam tourniquets and stuff like that. You should have, again, what you mentioned before, your list of medications and stuff. So if you do need to be taken anywhere, those are the major things. Kind of cuts and bruises and things to stop bleeding is usually what you need.
A thermometer.
For burns, thermometer so you can take your temperature, and a little bit of Tylenol for those aches and pains and fevers.
And also maybe, as you were saying earlier too, especially with it being the holiday time, sparkling water. So you have the bubbles.
The bubbles, and just sort of like a sports drink, an electrolyte solution, kind of like a Gatorade, so that if you are vomiting and things, you could not only replace the water, but the electrolytes as well.
In regards to where you see Adventist, Glendale as a community, what is your New Year's wish for them?
Be positive. Be hopeful looking forward, and so when you're hopeful looking forward, you don't necessarily overindulge in the moment. You don't overdo in the moment. Glendale is becoming quite a family, so I really like that. They're very much community now. I don't know, I like the way Glendale is changing. It used to be a very senior-based city long ago, and now we have such an influx of families. It's very intercultural now. We have so many people coming together. I think it's just marvelous. I think it's just lovely. And if people just don't get a little bit too indulgent, I think we can live with one another a lot better.
I personally want to say that I feel like my father had his hand in some of that.
He was visionary.
He was visionary, and it was all about family.
Yes.
What are your final thoughts in regards to what we need to know about the emergency room?
It's there.
Oh.
It's there 24/7. It never goes out. The light is always on, dear. The light is always on for whenever you need to have it. And if you think you're having an emergency, don't second guess. You don't have to Google. If you're
What about
panicking,
insurance? There's such a big conversation about insurance these days.
I know. But if you feel you are perceiving an emergency, then you can present yourself to an emergency department and you will be treated. We never turn anybody away.
I love that, and personally, thank you so much for taking care of my family.
It's been a pleasure.
Happy New Year again, everyone. And what I love that Dr. Jang said is, it's about family. It's about taking care of each other, taking care of ourselves. And since it's about family, instead of texting or instead of emailing, call your family, call your friends, put down the social media and get involved, have an interaction. I hope you join us next year, because our mission here is to make you the best you can be. And you can also find us on social media. You can join us on our YouTube channel at AHGLH Healthline. You can also follow us on Facebook at AH Glendale, Twitter at AH Glendale, and we are now on Instagram at Adventist Health Glendale. And we're also on the web at AdventistHealthGlendale.org. Remember, you are the captain of your ship. You make yourself who you are. And all we're doing is giving you information to make you the best that you can be. It's been a privilege, a pleasure, and an honor to be your host of Healthline. And I hope next year we bring you a lot more. Have a great new year. Please be safe. We'll see you soon. Take care.